Well, we're working at the individual level.
Uh-huh.
In that sense, we are working with mostly with girls, but also we are working with boys. But with girls, is particularly creating spaces for girls to discuss issues related to their body, to their rights, health issues. Even just having their spaces to share their ideas. Sometimes that
That's
doesn't
really
exist.
important.
Yeah. Also, we are working with starting also from a younger age. We are working with primary schools in 5th and 7th grade with boys and girls also to start talking about taking decisions, thinking about at that age of changes, of puberty, and also what those changes mean. Talk about menstruation, for example, which is also a big taboo and a suffering for many girls. And what that means. And so it's we starting to talk about violence and what is right and is not right. We start working around these issues in primary schools, then in secondary schools, and then also we have these groups of girls outside the school, because we also know that there are girls that or they left the school earlier, or they are married already,
right.
or because they got pregnant and then they didn't go back to school. So there are also many girls that are outside the educational system, and that we are also working with them. And we also have a community intervention, because we know that if we want to change the gender norms, and if we want a more enabling environment for adolescents and young women and boys to also have access to the health, sexual reproductive health services, the community should also be involved. It has to be supportive.
Yeah.
So we are working with community leaders. Actually, we have community leaders that are part of the project. They are involved in the project and they are allies, and who they also had to go through training, and also they are still in a process of also reflecting and learning themselves, and kind of, so it's but they are already, let's say, on our side. And we also work with other community activists that they are creating spaces within the communities to discuss around these issues. So we have different types of activities, community debates, groups where we have men and women together having open discussions and dialogues. We are also working with men. Some of them, what we say, the barrier men or the difficult men. Not all. It's not just groups of the difficult ones, but some of them are those parents that they want their daughters to leave school, or men that we know that they are a bit aggressive, or that so we have some specific, and with other men in general, we have specific also groups to discuss these issues.